We'll just give everyone a little bit of time to come in, and then I'll introduce you and you can get started. Just give them a couple of minutes.
Shall I share the slides from my screen?
Yeah, if you can, if you've got them, that'd be best.
Yeah, sure.
I've got them here as a backup in case.
No worries. Can you see that on your screen?
It's coming through. Yeah, perfect. Okay. So I think we've probably got, most people have probably been whizzed over. So I think we'll make a start. So just to introduce myself, I'm Maria Murphy. I'm an education training lead at Stockport CCG. I just want to, so we're recording this so people can access it later, as you can with any of the other sessions as well. So if I just introduce the two speakers that we've got with us today. So we've got Gemma Hall, who's the Talent for Care Relationship Manager for Apprenticeships, and she's from North West Health Education England. And we've got Nadine Littler, Workforce Lead, Nursing and Midwifery from Lancashire and South Cumbria Health Education England. I think that's right. So if anybody, I'm just thinking about questions before you begin. If we bob those in the chat, and if we've got time at the end, we'll come to them. And if we don't, we'll make sure they're answered afterwards, if that's okay. So over to you two. Thank you very much.
Thank you. So we've got quite a bit of information to give you, so we're going to whiz through it. There's a lot more information and detail. So if you are sort of considering nursing apprenticeships and you want further information and guidance, then do get in contact with us. We've got various documents and we've also got different webinars that we can invite you to so that you can find out the full details of information that you would need. But I'm going to cover sort of apprenticeship basics, things as employers that you would need to know, and then Nadine's going to thankfully take over and do all the nursing specific information because Nadine's a nursing background and I'm not, so hopefully we'll be able to cover all the questions that you might have. So in terms of apprenticeships, just to be really clear, in terms of the apprenticeship levy, it was introduced in 2017, and this is to fund apprenticeships. So it's very different to old style apprenticeships and how they used to run. We cover many, many different professions, and nursing is one of those professions. So larger employers in scope will pay into what's called an apprenticeship levy. So if your pay bill as an employer is more than £3 million a year, you will pay automatically into a virtual levy pot. This levy covers 100% of the education costs, training and assessment. It doesn't cover things like salary, transport, PPE, any other sort of additional costs. So they're things that you will need to be aware of as an employer. They do run differently to typical sort of traditional training courses, as apprenticeships combine on-the-job training activity with the employer and off-the-job training activity with the training provider or university. And apprenticeships do lead to a national qualification. The apprentices are employed in a real job. They have to be given a contract while they're with you for that real job. And they often additionally will achieve additional qualifications such as a degree, particularly if they're doing a Registered Nurse Degree Apprenticeship, they would get the degree as well. And in terms of using apprenticeships within the NHS, they can be used for both current employees employed with you and new starters into your organisation. So they can be used in both ways, and that's for any employer, not just NHS employers. In terms of the use of apprenticeships, whether it's NHS and social care, we know that there are sort of real changes in terms of demographics of current workforces, maturing workforces presenting sometimes problems in loss of skills as people do retire and move on. And then there's obviously various different changes to education provision and funding, and apprenticeship levy is sort of one of the new things since 2017 to really be one of those pots of money that can be used to fund education and training. So in terms of the opportunities, we have apprenticeships to be able to upskill and develop staff, so make sure they have the right skills and the knowledge, skills and behaviours which are determined by the apprenticeship standard to make sure apprentices are fully developed and trained in their role. They can help with delivery of new services, so you can look at how they can utilise or be developed, and how apprenticeships can be utilised to develop skills to deliver those new services and help with transformational care change, where you might have different models to work to. And ultimately, it's about making sure that staff are skilled appropriately and properly and to employer need to make sure that ultimately patient care is the optimum standard. So you can use them to provide career development, upskill existing staff, or for new recruits. Like I said, it helps with retention of existing staff and attracting new talent. So if you've got some really good staff in your organisations that are really keen to develop, utilising apprenticeships to help them develop and then retain them in your workforce is a really good opportunity. And if you're looking to try and attract really good quality candidates into your organisation, providing the option of an apprenticeship is a really good way to do that as well. And it does lead to a good qualified workforce. Ultimately, employers or apprenticeships are employer-led. They've been developed through trailblazers, including employers and other stakeholders, to make sure they do provide adequate training and education that's absolutely needed. The training is paid for by the apprenticeship levy, and I will talk about funding in a little bit more detail further on for smaller employers who don't have access to an apprenticeship levy pot. But ultimately, in terms of apprenticeships, you can have as an employer greater say in how training is delivered. So we run a lot of work across the Northwest in working with employers to make sure the provision is suitable and workable for what employer needs. And we are finding more and more anecdotally that apprentices are more likely to become long-term members of staff because they've received that training and development that they would like. So that can be really good for your retention issues as well. So in terms of apprenticeships and their impact on learners, it's an alternative to the traditional university pathway where they may have had to have gone through an academic background to then achieve UCAS points and get onto a programme and self-fund. Apprenticeships are obviously paid for by the levy, so they don't get into debt. They can earn as they learn, so they're not having to give up work to then go and self-fund on a full-time programme or a part-time programme. And it gives them that relevant work experience in addition to the qualification that employers really need to see. So when apprentices complete their apprenticeship, they are termed what we call occupationally competent because they've had that combination of on-the-job and off-the-job training. So if anybody is sort of looking at trying to develop business cases to get support in their organisation, we can help with that on our HASO website. There's lots of documents and resources there for you to use. Do get in contact with me if that's something you would find useful. I'm happy to share those and send you the links to those. But ultimately, you know, the sort of key points that we really look at when we're sort of working with employers to try and gain buy-in is thinking about that retention of existing staff that can really help in attracting new talent, supporting new roles and skills in your organisations. They can definitely be used to help develop those, and even sometimes in whole system organisation development, they can be really useful as well. So back to absolute basics in terms of what is an apprenticeship. So it is essentially a job with training, and it gives the apprentices the chance to gain the knowledge, practical skills and experience and behaviours that they need for their current job as an apprentice in their future career. And like I said, they combine that with off the job and on the job training. These are some example pathways that apprenticeships can help develop people through. So people don't always have to start at the very beginning, depends on their previous qualifications and experience as to where is the most suitable point for them to start. And they don't have to go all the way through the pathway either. They could decide to stop at any point once they're happy or you're happy as an employer with their position. So the first one in terms of nursing pathway, particularly if you've got somebody who is fairly inexperienced and sort of starting out at the very beginning, they may start on a healthcare support worker level 2, give them the grounding in terms of that role. They could then progress on to a level 3 and then move into a level 5 and then a level 6. They might also move straight into a level 5 if they've got the prerequisite requirements for that programme. They don't have to start at a level 2. So if you've got more experienced staff or people who've got previous qualifications, a level 5 going into a nursing associate apprenticeship and a trainee nursing associate position might actually be more beneficial for you and for them. So if you're wanting to sort of discuss the options in terms of staff and apprenticeship options, Nadine and I will be happy to help with that. This data is from the ESFA. We get this released to us, and this is the number of apprenticeship starts in the top 20, sort of highest number of starts of those professions. We've got many, many different apprenticeships that are available. These are just the top 20. And this is for the academic year 2019-2020. This is national data. So it just shows you in that particular academic year what the trend was in terms of most popular starts for apprenticeship standards. So it's really thinking about the future. We do expect to see an increase in particularly registered nurse degree apprenticeship and an ongoing increase in those nursing associate numbers because of the target associated with that. So it's just interesting to see the sort of current trend in terms of employers, and these are specifically NHS employers for this data. So in terms of your employer journey and things to think about in terms of where to start, certainly look at workforce planning, look at where your gaps are in terms of your future workforce needs, have a look at that data in terms of staff potentially retiring or leaving, what are the trends there, and where potentially apprenticeships could be used to help develop workforce to fill those gaps. Think about what vacancies you might have. Are you going to be recruiting in new staff, or do you want to develop those current staff through your appraisal process to identify what the development needs might be for them? Also think about the support available to apprentices. So we do need to ensure that there is adequate support within the employer around the support given to apprentices. And there are specific requirements that I'm sure Nadine will touch on in terms of the NNC requirements for support available to nursing apprenticeships particularly. And you do need to be committed to achievement. So both the apprentice needs to understand that any apprenticeship they undertake is a commitment to achieving that apprenticeship, and also employers need to be committed to supporting that apprentice to achieve. Need to be clear that the minimum 20% of the job training requirement is an ESFA funding rule, and it is a statutory requirement. Some apprenticeships require more than 20% of the job training, and certainly the Registered Nurse Degree Apprenticeship does require significantly more time available to be able to undertake their training and placement activity. So you do need to be very clear with the apprenticeship provider exactly what that off-the-job training requirement looks like, how that will impact you, and what additional placement activity needs to happen for them to be able to achieve. And you will need to have contact with the training provider at regular intervals to make sure that you're clear how the apprentice is progressing through their programme and that any support needs are picked up at the earliest opportunity. So just some points to think about who your target audience might be if you're going to be putting people or wanting to support apprenticeships. Would it be existing workforce, new entrants, or a mix? Do be clear about the entry requirements for apprenticeships. Often at a higher level, such as the Registered Nurse Degree Apprenticeship and the Nursing Associate Apprenticeship, people will have to have their Maths and English as a prerequisite onto those programmes. So that's functional skills level 2 or GCSE Maths and English grade C, and I think it's the new grade 4 that they will need to have. The apprentice would need a job role with a productive purpose, and it should give the opportunity for that apprentice to be able to embed those knowledge, skills and behaviours that they are gaining through their apprenticeship. So in terms of what you would need to do as an employer, you need to make sure they've got a suitable contract that covers the duration of their apprenticeship. If you're using fixed term contracts, you would need to make sure that fixed term contract gives them enough time to complete their apprenticeship, including their endpoint assessment. You wouldn't be able to put somebody on an apprenticeship if they've got a fixed term contract for 12 months and their apprenticeship will take them 4 years to complete. It's really important that that's not the case. Apprentices need to be paid at least minimum wage. That is something that is employer decided. So a lot of NHS trusts have a particular rule for their particular organisation and what they would pay apprentices. Other employers may feel different, but it's something that you would need to decide on and make sure that they are given at least minimum wage, if not more. And the wages must be met by the employer. Wages cannot be paid through the apprenticeship levy funds. Apprentices also must complete their apprenticeship in working hours. This is their normal working hours, not including overtime. So that's why you've got to be really clear as an employer exactly what that time looks like, the off-the-job training time and any placement time and any other time needed to be able to complete their apprenticeship. And this would include English and maths if they were somehow doing it as part of their apprenticeship. But like I said, for higher level apprenticeships, often they're required to do that before they're able to enrol on the apprenticeship. And then off-the-job training there is just clarifying that it is in the normal working hours of the apprentice, and that's about them being given enough time to achieve their apprenticeship, and they would need a suitable mentor at work. So in terms of apprenticeship funding, like I said, there's the apprenticeship levy. So this is for those employers with a pay bill of over 3 million a year. That pot is automatically paid for by, or it's automatically taken from the PAYE bill and it's put into a virtual levy pot. So any large employers, the levy pot is available. Reservation of co-investment is for smaller employers who don't have that large pay bill. So this is one option you've got. So what you can do is apply to reserve government co-investment, and under that one you would pay 5% of the cost of the apprenticeship standard and the government would pay the remaining 5%. That still again doesn't include wages, it just covers the cost of the apprenticeship standard. And then the other option is a levy transfer. So this is where a large employer with that big levy pot, potentially a big levy pot, might consider transferring some of their levy to pay for the cost of the apprenticeship standard for your apprentice. All of that is done virtually. It doesn't hit your internal budgets. It's all done through a virtual account. In this instance, through a levy transfer, 100% of the cost of the apprenticeship standard is covered, but again, it doesn't cover wages. If you are wanting to apply for either the government co-investment or a levy transfer, these all have to be set up and in place before an apprentice starts their programme. It's really important that's done because they can't be set up after they've started it. So that is absolutely vital. If you are wanting further support or help with either co-investment or levy transfers, we have a team in the Northwest who can help you source those and talk you through the processes of making sure they're set up. So if you are looking at either of those options, if you get in touch with me, I can put you in touch with that team. Levy transfers are not guaranteed. We have lots of contacts with other employers. We do ask them if they're willing to transfer, but we can't guarantee that they will. So if you are thinking of supporting an apprentice and you would potentially hope to achieve a levy transfer, certainly be prepared to pay for the co-investment route of 5% if in any eventuality a levy transfer can't be sourced. If you are from a larger employer who has access to an apprenticeship levy and you want to put somebody on an apprenticeship, please make sure you contact your organisation apprentice lead. They're the people who will have access to the levy pot and they'll be able to make sure that they have enough funds to cover your apprentices. That's really important as well. So in terms of maths and English requirements, for anybody undertaking a level 2 apprenticeship, all apprentices must achieve level 1 functional skills where they haven't got it already and work towards and take assessments for the achievement of level 2 in both subjects. There are some flexibilities currently due to COVID around the requirement to take the assessments at level 2, so that's available on the gov.uk website and I can share those details with you. For anybody undertaking a level 3 or higher apprenticeship, then before they can achieve their apprenticeship, they must have achieved their level 2 functional skills in maths and English, or if they've already got it, then they need to demonstrate they've got the evidence of functional skills or have done their GCSE maths and English grade C or above, or level 4, I think it is. But like I said, for the nursing associate apprenticeship and the registered nurse degree apprenticeship, often the apprenticeship providers require that people or potential apprentices have already achieved their functional skills or equivalent before they can enrol on the programme. So that's something just to bear in mind if you are looking at people who might want to do this or people you might want to support. That's one of the first checks to get done initially because it's really important that's done, and it can delay the process of them enrolling if they haven't got that evidence or they haven't done it before. Some people sometimes remember doing their GCSEs but can't find the evidence. If they can't find the evidence, then it's likely they might have to do it again. So even if they tell you they've done it, make sure you get their certificates to be able to show you that they absolutely have. If you have members of staff who haven't achieved their GCSEs or functional skills and would like to in preparation to undertake one of those high-level apprenticeships, then we have an online functional skills provision called BKSB. So this helps potential apprentices to study towards achieving their functional skills exam. So it's the learning that is given to them. And then we have provision as well to help people get through their exams after they've done that learning. So if you contact that email address there or your learning and development department, you will be able to get access for staff to that platform. And that's it from me, a real whistle-top tour on the absolute basics of apprenticeships. We do have apprenticeship information webinars which go through all the employer requirements and responsibilities in a lot more detail. So if you are genuinely thinking about putting apprentices on programme and would like to be fully prepared for that, if you send me an email, I will send you the booking form so you can come on to one of those. They're about an hour and a half long, they run monthly, but we would really advise you do that just so that you're fully aware of all your responsibilities and the things you need to think about to prepare for those. Are there any questions from the chat box on any of that?
There are a couple of questions. Yeah, so we've got from Sam. Thank you. It's great. How long would the RNDA programme be after transferring credits from the Nursing Associate programme?
Do you want to get this one, Nadine, or do you want me to pick it up?
Yeah, so Sam, it depends on the programme which university obviously you undertake the RNDA programme, because sometimes they do vary in length, but it's approximately half of that programme. So 50% of your nursing associate qualification can be used to the RNDA. So you're looking at about 2 years as an approximate. just depends on the programme that you're applying to. So check that out when you're looking at universities. And then Jill's asked a question about healthcare support worker. How long do you need to work before eligible for RNDA? There's no set time frame. Obviously, when applicants are applying to the Registered Nurse Degree Apprenticeship, they will look at experience within healthcare. So the more experience, the better. But there's no specific time scale that they need to be working in that role. How long would it, another query is, how long would the apprenticeship be if you're already an assistant practitioner? So again, like the nurse and associate, you can undertake the top-up conversion programme to registered nurse, which is, again, you can use 50% of your training from that qualification to the RN. So again, look at the programme length of the university that you're applying to. What I'll do now is some of the queries I'll be going over during my part of this session now. So I'll just pick on some key points, and as I say, you will have the slides after the session.
And just to advise, we've got 5 minutes, and I think we get flung out without any choice. So just to be aware.
Okay. So what I'll do is just very briefly on this point, just to mention there's apprenticeships. We've talked about nurse and associate. So this is a bridging role between the healthcare support worker and the registered nurse. We've seen the first cohort of nurse and associates in 2019. They're registered with the NMC, Nurse and Midwifery Council, and a protected title within law. So they work across a range of settings: hospital, community, private sector, social care, and they work independently under the direct and indirect supervision of the registered nurse. Next slide, please, Gemma. So just very briefly, we talked about some of the entry requirements already, so I won't go over them, but just to say the nurse and associate apprenticeship is 2 years. At the end of the programme, apprentices will have a level 5 foundation degree, and they'll be in their base where they're based, but they'll also undertake placements across other settings. They need to show that they've undertaken practice within learning disabilities, mental health, adult and child. And the most important thing here to mention is they will be assessed by a nurse and midwifery registrant, so on the register, and a practice supervisor who will be a registered healthcare professional to ensure they meet the competencies to be entered onto the NMC register. Next slide, please. Registered Nurse Degree Apprenticeship. So we said already the growing demand for registered nurses. So this apprenticeship is for anyone who wants to go straight in to be a registered nurse. So from a healthcare support worker, they can go straight onto the RNDA programme, or it can be used as a top-up, a career progression route for an assistant practitioner or a nurse and associate to then top up to become a registered nurse. And again, they work in all settings and across all fields of practice. So this full programme, the full programme is usually between 3 to 4 years. That's for somebody that goes straight onto the RNDA programme. And as I said before, if you're an assistant practitioner or a nurse and associate, you can transfer your credits and hours from that programme 50% onto the full programme, so effectively half of that. You're working across a range of settings again: hospital, GP practice, community, and across all fields of practice. And again, most importantly, you will have a practice assessor, NMC registrant, and also a practice supervisor to ensure you meet the competencies. Next slide, please. Funding. Now this will come out, so if we do get cut off, just to say that there's funding available for nurse and associates, anyone that wants to train in this route. There's a standing fund. This is the employer support grant. So this is for employers that are supporting apprenticeships to do this route. They can apply for a standing funder offer of £4,000 per year, because it's a 2-year programme. And that's, as Gemma said, that's to support travel expenses, uniform, and that wider workforce. For anyone that's working in 50% of their practice within a learning disability setting, they can also get an enhanced offer on top of the £4,000 per year, and that's an additional £3,900. But again, after this webinar, we can go through more details if you require. Next slide, please. And then finally, just to say that there is top-up funding available for anyone that's done the assistant practitioner or nursing associate that wants to convert to registered nurse degree apprenticeship. 2 years, organisations, employers can apply for the 8,300 per apprentice per year. It's available for 2 years, obviously, but the proviso to that is that applicants must be registered on the NMC, completed the programme, registered on the NMC and be on ESR by March 2024, because this is linked to the government manifesto funding. But again, expressions of interest, queries, please contact Gemma. And then finally, just to say, there is no current funding available for the full RNDA programme from September onwards, and there's a hard close now on for any starts before August of this year. That's it from myself, thank you.
Well, that was fantastic. A whistle stop tour. I don't know how you managed it, but thank you.
Thank you.
It looks like we've got most of the questions, all of the questions answered. Katie was talking about any documents, further information, and obviously you
Yes.
provided that with the links. All the presentation and the film will be put on the Primary Care Careers website as well, so will be available afterwards. So I don't know, we usually get a 10-second warning, so if anyone has got any questions, now is a really good time to throw them at them while we've got them.
Can I just say one thing about the top-up funding here? If anybody is interested in that top-up money, we need to know immediately to make sure that we can support people on programme, because the eligibility is very specific. Any top-up funding, the eligibility criteria is that people put on that top-up programme must be registered with the NMC by March 24. So I would need to know pretty much in the next week or so if anybody is interested, because it's no guarantee of funding. I would need to go back to the team and check that funding's available.
Right, thank you very much for that, and we're about to go, but thank you.